Hey everybody, welcome to Pick Dr. Osborne's Brain. I've got a great show for you tonight. We're going to be talking about leaky gut and a number of other inflammatory problems that can wreck or damage your gut. So if you've got gut-related questions, if you think you're struggling with leaky gut, or if you think you've got some type of health issue revolved around or starting in your GI tract, tonight's show was done just for you. Now, if you've got questions you want to get in before the show's over, make sure you go ahead and start pumping those into the feed. You can do so either on Facebook or YouTube. We're live streaming, and so we will be taking those on a first-come, first-served basis. So make sure if you've got, again, try to keep it gut-related. If it's a good gut-related question, I'm going to do my best to get to it. Hey, if you're new to the Dr. Osborne show, make sure you say hello. Don't be a stranger. Become a part of our community. You can do so by subscribing. You can also go visit me at glutenfreesociety.org. Make sure you subscribe to our newsletter there, where we'll send you all kinds of great information and free updates on health and wellness and the gluten-free diet. So again, welcome to the show. Tonight's topic is gut-related. So we're going to be talking about ways to improve IBS, and we can call that irritable bowel, we can call that inflammatory bowel. It can go either way: IBS, constipation, indigestion, heartburn, and other leaky gut-based types of conditions. So we're going to go deep. You're going to learn things that you didn't know. You're going to learn things that probably shock you, and that's the whole point, right? So before we dive in, let's talk about functionality, the 5 barriers of the GI tract. Now, it's important to understand these 5 barriers because the barriers set the stage for healthy gut and healthy food tolerance. When these barriers are breached, when they're broken down, what ends up happening is problems, right? When these barriers are broken. So think of your gut. If I could just describe your gut for you, your gut from your mouth to your anus is a tube that runs on the inside of your body. It is not part of your bloodstream, and it's designed on purpose for that intent, meaning it's not connected directly to your bloodstream. That's why we have barriers. These are barriers, okay? These are barriers to the GI tract, meaning they help keep the quarantine zone of your gut from leaking into your bloodstream. Imagine poop leaking into your bloodstream. That's what we don't want. Imagine proteins that are harmful, plant proteins, animal proteins that are harmful unless properly broken down. Imagine chemicals in your food, or bacteria or viruses or other fungal elements or parasitic microorganisms in your food. Your gut's job is to take those things and destroy and separate them, form poop with them, and get them out, excrete them out through your anus. It is not to allow those things to leak into your bloodstream, because once they start leaking into your bloodstream, we can get systemic inflammation, and it's that systemic inflammation, systemic meaning throughout your entire body, that can start to deteriorate and break your health down slowly, creating chronic inflammatory diseases, many of which are autoimmune problems. Autoimmune diseases like hypothyroidism, autoimmune diseases like rheumatoid arthritis and type 1 diabetes, autoimmune diseases like ankylosing spondylitis and Reiter's syndrome and Sjogren's and Hashimoto's. So stay with me, because this topic is super important. Now, again, 5 barriers. What are they? The first we talk about is probably one of the most important, is the GALT. Now, the GALT, that stands for gastro-associated lymphoid tissue. This is like a massive set of tonsils that wraps around your small intestine. And researchers kind of argue back and forth that 70 to 80% of your entire immune system is in your GALT. Now, that should tell you something, that the grand design of your body thought it necessary to focus that much immune power right here. Why? Because what's coming into your mouth, what's coming through your mouth, has the potential to be very, very dangerous to your bloodstream unless it's properly broken down and vetted, okay? And so the immune system is super ultra concentrated in the gut for that reason. It's to protect you from those things. So GALT, very important. The second barrier are your tight junctions. These are the bridges in between gut cells. So imagine this is a gut cell over here, this is a gut cell over here. In between, there's these little bridges, these little anchors called tight junctions. It's what keeps things from leaking, okay, into, over here's your blood, and up here is your gut. So things leak through those two cells leak in between. You can see it a little bit better here. If things leak in between the two cells, they hit your bloodstream. And when they hit your bloodstream, that's systemic inflammation. So it creates a lot of problems. So these tight junctions are very important. This is one of the reasons why we focus so heavily on a gluten grain-free diet. Because it's been very well established that gluten, even in people that are not celiac, gluten in non-celiacs causes a disruption of these tight junctions. And so that's very, very important to understand. We don't want a disruption in those tight junctions. That allows all kinds of garbage to leak through from your poop. Again, what's in your gut is your poop, right, or will be, and it allows those things to leak into your blood, which we don't want. Then we have what's called the mucosal barrier. The mucosal barrier, on the surface of your GI cells, there's this layer of mucus, okay? Layer of mucus. And that mucus is very critical, very important. It's a physical barrier. So it serves a couple different things. Number one, it lays down a physical barrier so things can't penetrate in. Number two, it serves as a home, in a sense, for good bacteria. So the healthy microbiome, those healthy bacteria live, they adhere into that mucus lining, and they serve to help protect us. They also talk to, again, these friendly bacteria talk to the GALT. They talk to the immune system. These friendly bacteria live in that mucosal barrier, in that mucus. And so very, very important. If you've ever eaten a piece of food, if you've ever eaten something and you started getting a lot of phlegm production, having to clear your throat super frequently, this is your body's immune system producing more mucus to protect you from something in the food that you just ate. So this, again, very, very important. And again, the friendly bacteria, they do something called immune crosstalk. They talk to your immune system, and your immune system talks back to them. And why would they do that? They talk to each other. They communicate about the contents of your GI tract so that they can prepare for things that might be dangerous or bad or harmful for you. This immune crosstalk, very important. That's just one of the functions of the good bacteria. So that immune crosstalk, we'll call it function number one of good bacteria. Other functions of the good bacteria is they actually help produce mucin. Mucin, again, that's their home, right? They produce what they live in, which helps with that mucus barrier, that mucus lining. A third function of these good bacteria is vitamin production. They make or help you make vitamins. They also, we're on number 4 here, they help you digest your food. So these bacteria, we want them there. And a lot of people, we think about things like antibiotics. An easy way to destroy the gut lining and to compromise it is to wipe out your friendly bacteria. So antibiotics do that. We'll get into that in just a little bit. Then we come over here to this 5th barrier. This barrier is your stomach acid. And this is another one that people medicate into oblivion, unfortunately. Stomach acid's critical. It's important. And it's important to also understand that the symptoms, a lot of times people talk about reflux. Oh, I feel like, acid reflux. Most of the time, acid reflux symptoms are not too much acid, increases in acid. It's actually not enough acid. So a lot of people that think they have acid reflux actually have low acid production. They're not the same thing, but the symptoms are very similar. Now, the way to differentiate, if you go to your doctor, they usually can do a scope and they can kind of look in there. And what the scope tells the GI doctor is the scope will tell us whether or not there's inflammation directly in the esophagus or the stomach. It won't tell us why the inflammation's there. But the assumption is always there. Most GI doctors assume that the redness or the inflammation is too much stomach acid, and I would challenge that assumption is wrong in most people. It's not too much stomach acid. It's that you're doing something that irritates the stomach. What irritates the stomach? For most people, it's their diet. It's bad diet, wrong diet, food sensitivity, food allergy, gluten, food chemicals and other compounds that are found in food that don't belong in your stomach that create an irritation to your stomach, leading to the symptoms of acid reflux, but again, it's not acid, it's irritation that leads to inflammation that gets diagnosed as acid reflux, and then the doctor usually, what do they want to do? They want to prescribe an antacid or an acid blocker. And when you block acid, if acid is not the problem, what you actually do, understand why we're talking about acid. Stomach acid is a barrier. When you block that acid, you increase your risk for the development of infection. So this is how the acid, when you eat food, there's a lot of bacteria, there's viruses, there's all kinds of microorganisms in that food, naturally, okay? And when you swallow that food, your stomach acid neutralizes a lot of those potential bad guys or pathogens. And when it neutralizes them, now they can't get down lower into your mucosal barrier and penetrate through a leaky gut, right? So this is a very strong barrier that helps prevent infection. But that acid's also important in digestion. So it's not just preventing infection, but it helps you to digest. And one of the things that helps you to digest is protein. Protein important because protein is the building block for healing and repair. And many of you struggling with chronic inflammation or chronic inflammatory diseases are struggling on this front. You're maybe not getting enough protein, enough of the building blocks, the amino acids to help you heal and repair. This is super critical. But the other function of the stomach acid is absorption. So it helps you digest protein, but it also helps you absorb nutrients. And so vitamins like B12 and calcium and magnesium and iron, all of these require acid to be properly absorbed. And so when you block stomach acid, you now create vitamin and mineral deficiencies that can damage you. Let me give you an example. Let's make a little bit of room here. Let's see, let's just shrink this up. So if you cause, for example, a vitamin B12 deficiency, well, why do you need B12? Let's change our color here. So B12 helps to synthesize new DNA and RNA, which is important for cell production or cell replication. So new cells are produced as a result of B12, right? Now your gut cells, they live every 2 to 7 days. Your gut lining is new. If you don't have adequate B12, what happens is your gut lining can't replicate new cells efficiently. And so what happens is cells get really old and they start breaking down and they start losing their function. We know that B12 deficiency, reduces gut function and predisposes to intestinal permeability or leaky gut. We see this probably most commonly in cancer patients who are on medicines that destroy the gut lining. In order for those cancer patients to recover their guts functionally, we need a lot of B12 to make up the difference. B12 and also folate, another important one for gut cellular repair and turnover. So what ends up happening is their gut function deteriorates rather quickly. When your gut function deteriorates, you can't eat, you can't digest, you can't get nutrients from the food, you can't heal, you can't repair. So again, this is just an example of why we need that acid, right? And if you go popping the Tums, the Rolaids, the antacids, right? Even the prescription or over-the-counter ones, you're going to end up causing maldigestion, malabsorption of these very, very critical nutrients that are important for your overall gut function, and thus you're going to create a vicious cycle of compromising whether or not your gut is capable of healing. Remember this statistic, 60% of gut nutrition is your food that you eat directly, meaning that your gut, unlike other organs and other tissues in your body, the nutrients are processed and then dispersed through the bloodstream. But your gut directly gets 60% of its nutrients from the food, from the lumen of the intestinal lining. So if you're compromised in your ability to digest, then your gut becomes compromised first. And so when your gut is malnourished, the rest of your body over time starts to become malnourished. And this is again why it's such a vicious cycle. Let's talk about contributors to gut function and gut disruption. So this is, when we ask the question, instead of asking what, right? So don't ask what. Instead, ask why. This is, in my opinion, this is the mistake most doctors, most people make when they're trying to address why they have a symptom or why they have an illness or why they're struggling with their health, is they only answer what? Most doctors will tell you, oh, your gut's inflamed, okay? That's what. The next question should be, why is my gut inflamed? What's creating the inflammation? It's not that I'm just magical and have bad DNA or, I'm having a bad day. There's a reason why that inflammation is there. So don't answer what, answer why. If you learn to ask this when you're visiting your doctor, if you learn to ask this question every time, why? Every time he gives you an answer, ask why again until you get to the final common denominator of what is the trigger, what is the origin or the root cause of the problem. Okay, ask why and you'll get better answers. So let's talk about some of the whys. These are some of the big whys, okay? And one of them is medication. I know that may sound contradictory because a lot of doctors, what do? They treat you with medication. They treat not your disease. Remember, medicines don't really treat disease as much as they treat the symptoms that manifest as a result of the disease process. When you treat symptoms, you're treating the what, but you're not treating the why. And this is why medications can create more problems for a lot of people. One of the things that medications lead to is they can cause a disruption in your body's ability to taste and smell. And one of the, depending on the medicine, many of, for example, your blood pressure medicines and your diuretics deplete zinc. Zinc is responsible for your capacity for taste and smell. That's why so many people that get viral infections, colds, etc., lose their ability to taste and smell for a time because their body's depleting zinc to try to fight the viral replication. And so that zinc deficiency sets in and creates a lack of taste and smell. So diuretics, other blood pressure medications can contribute to that zinc deficiency, as can many other medications. We also know that dry mouth, many of the medicines dry up the mouth. For example, pain meds. Pain meds, so if you're taking medicine for pain relief, you're going to dry out your mouth. You're going to dry up your mouth. Why is that important? Your mouth produces what? It produces saliva. That saliva does what? It contains antibodies and it contains enzymes that help you digest your food. So the saliva, the antibodies are immune protection, right? The enzymes are digestion. They aid in your digestion. So if you dry out your saliva, if you dry out the glands themselves, and some of you have an autoimmune condition, probably heard Sjogren's. Sjogren's is an autoimmune disease that causes an immune attack against the parotid, the submandibular glands in the mouth, and it dries them out. It dries out the tear ducts, the lacrimal glands. And so that dry mouth, less saliva production, lowered antibody, lower immune power, lower enzyme production, because those things are secreted in the salivary juices. So we know many medications can do this. Pain medicine is probably the most common that create that dry mouth or that dry issue. Now, many of you, with the marijuana becoming more popular and the THC becoming more popular, this is another major problem that we're seeing in chronic marijuana users. That dry mouth, that cotton mouth starts to develop. We also know that antibiotics, right? And we talked about this a minute ago, but antibiotics wipe out the good guys. They don't just wipe out the bad guys. Antibiotics are not selective for bad bacteria. They're actually not selective at all. And so they're going to wipe out the good as well as the bad, leading to, right, a reduction in your body's ability to digest. As we said a minute ago, what do these bacteria do? You digest with them, you make vitamins with them, you make mucus lining or mucin. They help you produce mucin, and then they're part of your immune system. They're part of talking to your immune system. You wipe these guys out, one of the next things that happens is a yeast overgrowth. And that yeast that yeast overgrowth, remember I've talked about this in a number of prior episodes where yeast contributes to GI inflammation, multiple reasons, but one of the big reasons is yeast can mimic gluten. So if you're on a gluten-free diet and it's a necessity for you if you're gluten sensitive or if you have celiac disease, but you're taking antibiotics frequently and you've got a yeast overgrowth, that yeast can mimic gluten. The proteins the yeast produce can mimic gluten, and so you can continue to behave as if you're getting gluten exposure over the long haul. So very, very important. Some medications disrupt immune function. Probably some of the best examples here, Tylenol. This is over-the-counter stuff. Ibuprofen. They disrupt your immune function, weaken it. Steroids weaken your immune function. I had a gentleman come see me this week on what I thought was extremely dangerous levels of steroids that his other doctor had sanctioned. You know, steroids are something to be dispensed with very extreme caution and in very low doses. And this gentleman was probably on, 4 to 5 times the magnitude of what we would see in a sane world. But steroids can be a major immune system disruptor. And then you have other drugs that can disrupt the immune system. Probably some of your more common ones are those of you who take medicine for allergies. If you're taking allergy medicines, they disrupt and suppress immune function, and they also suppress stomach acid as well. So again, any of these things, not only do they disrupt immune function, but for example, ibuprofen and steroids, especially when given in combination, destroy the lining of the gut. And this has been very well studied for 20 plus years. We've known this, but it doesn't stop doctors from dispensing these things without giving adequate warning about the potential long-term consequence. Some medications disrupt digestion. We mentioned a moment ago the antacids, right, are a big one. The antibiotics are a big one. So a lot of your blood pressure medicines, one of the reasons why we come back to zinc, when you block zinc, when you deplete zinc, zinc is necessary to form a number of your digestive enzymes, and so zinc deficiency plays a role in digestive enzyme deficiency. Some medicines also affect your liver. Your liver, remember, your liver is responsible for bile production. Bile aids in digestion of fat. And so if you're on medicines like, again, Tylenol, it damages the liver, which can damage your bile production, which can then start to disrupt how your body is capable of breaking down fat. And fat, what is that? Fat's important, right? Vitamin A, vitamin D, vitamin E, vitamin K, omega-3 fatty acids. Those are all essential fats that if your bile production is hampered, if you're damaged, if your liver's being damaged by certain medications, and remember, a lot of the medications are metabolized by your liver. So this is one of the reasons why doctors oftentimes will test your liver enzymes like ALT and AST. So if you ever had those blood tests done, these are tests that can measure liver damage. And so your doctor's just measuring your liver because that drug can damage your liver. A common one here are statins. Statin medications to lower cholesterol are notorious for causing liver damage, but so many other drugs can do it as well. We also know that some drugs can disrupt neurotransmitter production. And this is true of antibiotics specifically, and one of the reasons why there's some species of bacteria, like lactobacillus and bifidobacter, these species produce dopamine, and they also produce serotonin. These are neurotransmitters, and this is why so many people with depression have gut problems, because it actually begins in the gut. The depression starts in the gut because the antibiotics disrupt neurotransmitter production, leading to a reduction in the ability to make these neurotransmitters from the healthy bacteria that colonize the GI tract. Remember these numbers here. Dopamine, 60%, as far as we know today, 60% of dopamine is produced in your gut, 90% of serotonin is produced in your gut, not in your brain. And so then these neurotransmitters they traverse to your brain and help your brain function, but they're produced by the gut, in the gut, by these healthy bacteria. So very, very important. And then we have drugs that make it hard for motility. Okay, so they slow down the gut motility, creating constipation. Again, the biggest one here is pain meds. Pain medications really alter gut mobility. Other drugs, some of the drugs that affect nerves. So, kind of a common one is gabapentin, which is a drug given to people with restless legs. It's sometimes given for neuropathy or nerve pain. But these medicines slow down gut motility, creating constipation. Now, what I mentioned earlier, if you've got constipation and you combine that constipation with a breach in your mucosal barrier or a leaky gut, right? Now that poop just stays there, right? It just hangs out, and all those toxins from it basically leach into your blood, right? So we never want constipation. Constipation is a hallmark problem for people that have leaky gut, because if that gut is leaking, then that poop is not moving, then that poop is leaking into your bloodstream at a much higher rate than what it would be typically healthy. Okay, let's talk about other big factors that can disrupt your digestion and gut function. One of the biggest is right here, and this is one of the reasons why I wrote No Grain, No Pain. If you haven't read that book, if you haven't picked up a copy, you can buy it at any major bookstore. You can download it from your library. You can, you can check it out at your library. But gluten and grains, and I go into very, very great detail within that book, but gluten and grains, and one of the reasons why is we know that this causes leaky gut. So we know it disrupts the tight junctions in the GI tract. It causes an elevation, or it increases, there's a protein that causes leaky gut called zonulin. And so what grains do is they increase your zonulin production, ripping basically those gates, ripping them wide open so anything that's in your gut can leak through. And this, again, remember what I said earlier, research now shows that this happens even if you don't have celiac disease. So leaky gut occurs even if you don't, even if you don't have celiac disease. So you could have gluten sensitivity or non-celiac gluten sensitivity, non-celiac. Again, this process still happens. It's been measured and it's been shown to happen in people that don't have celiac. We also know that gluten disrupts digestive enzyme production through a number of different mechanisms. One is through malabsorption. So we've got, you've got malabsorption of nutrients. And that malabsorption of nutrients, remember what you need to produce or make digestive enzymes leads. So, again, you need things like, what do we make digestive enzymes from? We need protein, we need zinc, we need other nutrients like copper to properly produce these enzymes. And then these enzymes help us to chemically break down our food and get access to the nutrients from our food. So if we're struggling with this problem and this problem, and now we have digestive enzyme inadequacies, we're in big trouble. Now, there's another mechanism here, too, is that gluten has been shown to damage your pancreas. So we get pancreatic disease, we get liver fat deposits or fatty liver. We know that gluten can cause these things as well. These have been well studied. Pancreatic inflammation or pancreatitis, as well as fatty liver disease, have both been identified as diseases that can be caused as a result of gluten exposure. Now, the pancreas is responsible for making enzymes like elastase. This is an enzyme that helps you digest your food. The pancreas also produces amylase, which is an enzyme that helps you break down carbohydrates, and lipase, which is an enzyme that helps you break down fat. So this is coming out of your pancreas. If your pancreas is inflamed as a result of gluten-induced damage, this process can be compromised. And I've seen this in a number of cases. We also know gluten can damage the liver. So going back to why is this dangerous? Because this can create bile issues. And what happens to a lot of people is they end up getting their gallbladder removed. So they don't have a gallbladder. No more gallbladder means inadequate bile secretion into the small intestine, and that inadequate bile secretion means fat malabsorption, and that fat malabsorption means nutrient deficiencies of things like vitamins A, D, E, and K, which are notorious for contributing to cancer and inflammation and heart disease and leaky gut and a host of other types of problems. So we know this is just kind of the tip of the iceberg of what we know gluten can do, but I wanted to give you, those of you maybe are newer, it's a little bit of background into what gluten can do. For everyone, it can cause leaky gut. And for many, it can cause, again, liver and pancreatic damage that leads to malabsorption syndromes and digestive enzyme problems. We also know other factors that disrupt gut digestion and gut function. A big one, this one is one of the most ignored, is glyphosate. GMOs, especially those sprayed with this substance known as glyphosate. Now, it's been established that glyphosate causes cancer. It's been established that glyphosate is a dangerous substance, okay? There was a lawsuit, I think it was about a year and a half ago, where the company that produces glyphosate was found guilty for causing a type of cancer called lymphoma in a man who was, gardening and spraying and applying the glyphosate, but he was exposed to it over long periods of time, and they proved that it caused his cancer. So we know GMOs also, so aside from the fact that GMOs are sprayed with glyphosate, we know that GMO grains, as an example, have been genetically modified to, keyword, survive better. That means survive your digestion better. That makes them harder to digest. That makes them more difficult to break down. That means it puts more of a burden on your GI tract. We know some of them produce their own pesticides, some of these GIs. What is a pesticide? A pesticide is an antibiotic. We talked about antibiotics a minute ago, but just because it's not a prescribed antibiotic doesn't mean it doesn't have antibiotic properties in your GI tract to your healthy bacteria. We also know that many of these GMOs are sprayed with pesticides known to disrupt the biochemistry in the GI tract, not just in the GI tract, but especially in the GI tract. So this is one of the reasons why we highlight organic. And some of you maybe follow like the dirty dozen. You avoid the things on the dirty dozen list. Look, buy organic. Don't beat around the bush here. If you're not buying 100% organic, you need to start looking at how you can make that happen in your life. This is super critical. You have to understand that we've never had a time in human history where there's been such a mass scale, in my opinion, of poisoning of people through eating the conventional food. But that's what pesticides are, folks. They're poisonous. And when you use foods that all contain pesticides and other GMO aspects, then what you're really doing is you're putting things in your gut that have the potential to harm you. We also know that food additives are a big one too. So notice the trend here. Factors that disrupt digestion and gut function. What's the commonality here? Any takers? First taker that types into the feed what the commonality is between these three things. I'll give you a free copy of No Grain, No Pain. We'll send you a free copy of No Grain, No Pain. So we'll wait for that answer for the first taker. Commonality between these three categories, okay? So the food additives, the meat glue, otherwise known as microbial transglutaminase. Microbial transglutaminase is an enzyme produced by different types of bacteria that is used to piece meat together. So when you go to the fast food line and you're buying the chicken nuggets or you're buying a chicken breast, it's not really a chicken breast, it looks like a chicken breast. It's been glued together with this bacterial pink slime called meat glue. And one of my colleagues, he's doing research on this topic, and he's finding that it mimics gluten. And a lot of people that go on the gluten-free diet that continue to eat products that have meat glue in them continue to struggle because of that mimicry. And this is, so again, meat glue is used in processed meats, foods, and dairy products, and that's where you have to be the most careful. If you ever go get sushi and you get that imitation crab meat, that's pretty much all meat glue. There's no crab much in that. But again, inflammation in the gut. Some of them produce their own pesticides. Food gums. Food gums are a big problem for a lot of people as a food additive, and they're commonly used in things like almond milk or cashew milk. Some of those milk substitutes, they use gums to thicken those things up. So if you're a big drinker of non-milk milks, look at the food gum ingredient. Again, some of them are dangerous. One of them in particular is called carrageenan gum. If you're looking for a better one that's a little safer, look for this one, guar gum. That's one that's generally pretty safe. But again, these food additives, many of them have also been shown to create GI inflammation. So did we get any takers on the question? Anybody get it right?
What's your official answer?
It's that everything on this list comes into the body through your mouth. So if anybody got that, it was a pretty obvious answer. But it comes through the body, through the mouth. You eat them. In essence, what I'm trying to drive home for you folks is this. If you've got a GI problem, you have to first analyze what you're eating. You can't, you can go to the doctor's office and you can have a scope and you can have them run a camera through you and you can look for the what's. But if you're not asking the why, what is it that I'm currently doing, that I'm currently eating, that is contributing to this potential problem, then you're asking the wrong question and you're not going to get a good answer and you're not going to get a solution. And that's sad. That's disheartening because so many people out there have these problems and they don't even know why. Okay, let's talk about solutions. So there's 4 strategies I'm going to give you tonight that can help your gut recover. Remember, step 1 in this entire process, step 1 is remove the offenders. So this is the food that you're eating that might be creating the damage. This is what's in the food that you're eating that might be contributing to the damage. What are the offenders? The offenders are the foods, the GMOs, the pesticides. The offenders are anything that you might be sensitive or allergic to. It's the food preservatives, it's the dyes, it's those things. Those are the offenders. So maybe we should say step 1A is identify and then start removing the offenders. You've got to give your gut an opportunity to heal, and you're not going to let it detox. It's not going to recover very effectively if you keep doing the very things that are creating the irritation. So aside from this, after this, now we can start doing things to help our gut recover better. And one of the things that we can do is, contrary also to the nutritional advice you've probably been given, is don't eat frequent meals. We always hear breakfast is the most important meal of the day. We always hear you need to eat several small meals of the day or small meals each day to keep your metabolism going. Like, all that is myth. Nobody's ever proven that any of that's effective. As a matter of fact, we've proven just the opposite, that eating very infrequent meals actually does something very important. It gives your gut rest. And just like when you exercise, you need rest before you exercise again. If you don't allow your gut rest before you ask it to digest again, it's going to be overwhelmed, especially if it's already got a lot of these offenders. So especially if what you're putting in and you're calling food, right, is an offending agent, the more frequent you eat, the more damage you create. But when you eat, again, there's a strategy. This is actually called intermittent fasting. And there are different strategies behind intermittent fasting. I've done some shows in the past on deeper dives of intermittent fasting, but probably the simplest way to get started here is give your gut 16-hour rest periods. And if you rest your gut 16 hours, that means you have an 8-hour window to eat your meals in a day. Then your gut's going to get the vast majority of that time off. It's going to be able to recoup and recover. So again, this is very important for improved digestion and gut function, is to incorporate this. Now, some people go longer. They'll do 18 hours of intermittent fast, or 20 hours of intermittent fast. And those are okay too. Not everybody can tolerate them initially, because fasting for prolonged periods of time, especially if you have a blood sugar issue, and if you have cortisol or insulin imbalances, that can be a bigger challenge. But this is one of the top strategies, one of the most effective ways to start moving your gut in the right direction. Number 2 is eat when you're calm, when you're at peace, right? Most people eat on the run. What happens when you eat on the run is you activate part of your autonomic nervous system. The autonomic nervous system, okay, this is the nervous system. You don't have to think about it working, but there's a part of it called the sympathetic. And so those of you maybe don't know what I'm talking about, maybe you've heard of this. fight or flight. This is the nervous system in your body. The sympathetic nervous system is the fight or flight nervous system that controls the stress mechanism. So when you're under the gun and you're under stress, your body's gearing up to either fight or to run, okay? And when we're eating, we don't want to do either of those things. When we're eating, we want being at peace. We want relaxation. And so relaxation, how do we get relaxation around the time of our meal? Well, one of the things we can do is we can meditate. We can do deep breathing exercises before we eat. Some people sit down and say a prayer. I would say you can pray and meditate and do deep breathing all at the same time. But get your mind in a relaxed state. Sit down when you eat. Eating on the go, eating when you're walking, eating when you're working is a big part of the problem, because when you're doing those things, your body's nervous system is here. And so what this does is it blocks digestion. And so when you're putting a bunch of food in your gut and asking your gut to digest your food, but you're telling your nervous system to distribute all the blood to your muscles to prepare for fight or flight, remember, when we digest, the blood goes to our gut on purpose. This is why after a big meal, what do you want to do? You want to go lie down and take a nap, because the blood's not here and the blood's not in your muscles. The blood is in your gut. It's going to your gut. It's being sequestered to your gut to do the work of digestion. So you have to honor what eating is. Eating is done at peace. It's done in a calm scenario. You should slow down and you should take time to eat properly. If you don't, you put stress in your gut when your gut is not capable of proper digestion. And then what does that do? When you don't digest your food, what happens? Your food rots. But it doesn't rot on the plate. It rots inside your body, right? And if your gut's leaking, now all that putrescence, all that putrid byproduct, as it sits there, as you're constipated, as you're not going to the bathroom, as that food just sits there and is sequestered right there in your gut and doesn't move, it starts to decay. And all that decay byproduct, now if your gut's leaking, leaks into your bloodstream, making you tired and lethargic and not feel well and having general malaise and fatigue and chronic inflammation. So eat when you're calm. So eat when you're at peace, right? Don't have a phone argument with somebody and then sit down and try to eat your meal. Number 3, perform deep breathing before eating. And I like to do 5 minutes of just sitting, calming the mind, doing some deep breathing exercises before the meal. Okay? And so this type of breathing is more like yoga breathing. Those of you familiar with yoga breathing, it's belly breathing, where you breathe and you fill in, you don't fill up your chest, you fill up your diaphragm. And so you take about 4 seconds to breathe in, you hold that in breath for about 3 seconds, and then you exhale for about 5. Do that for a total of 5 minutes. And what that actually does is it activates the parasympathetic nervous system, which is the nervous system that improves and promotes digestion. It doesn't block it. So we want to turn on and activate parasympathetic nervous system. What some people will do here is they'll use certain essential oils before they eat, like lavender, which can be a very calming essential oil. Lemon balm can be a calming essential oil. So there's some essential oils that can help activate the parasympathetic nervous system, but I don't like to use essential oils personally because they affect the way I'm going to taste my food. So I like to do this deep breathing. I like to make sure I take a little time, set it aside for when I'm going to eat, where I'm not thinking about work. I'm not thinking about the 1,000 things that I have to do tomorrow or something that's stressing me out, where I'm just thinking about being at peace, right? Just being at peace and being in that moment and having, again, that time where we can get calm, okay? And number 4, and you might be thinking, gosh, Dr. Osborne, that's kind of a silly one. Take a nap after eating. Most of you who, especially if you're tuning in the United States, now if you're tuning in from Europe or across the ocean or across the pond, most of you are like, yep, I do that already. That's great advice. We call it down south in Texas, our neighbors even further south call it a siesta, and it's part of their culture. It's part of the culture, which is to take a nap after a meal. And this is because, remember, we want to sleep and rest so that that blood stays in the gut and does the work of digestion for us. Remember, digestion is critical to get to those nutrients. And so many of you eat and then go right back to work, and that food, it's just not moving. It's not going anywhere. So take that nap. It doesn't have to be super long, but you ever see animals, after animals eat, what do? Just by nature, they lay down. They take a nap. Doesn't matter what animal you're talking about. Pretty much every animal, you watch them eat, and then what do? They lay down, they rest, they take a nap. Humans are the only animals that ignore good sense for the sake of go, and they end up losing out on this very major benefit. Again, this is engaging of the parasympathetic nervous system, engaging of digestion. Why do we do these things? Why? Because generally speaking, if we struggle with a leaky gut, if we struggle with GI symptoms, it's because our gut is irritated, it's because our gut is overwhelmed. So think about this from the common sense perspective. What are we really after here? We're calming things down. We're promoting behaviors that make digestion turn on, that make digestion easier. We're eating less frequently because we're putting less of an overall burden on digestion and the timing in the course of the day where your gut is being demanded to work overtime to process the food that you're eating. So again, the name of the game is take away the triggers, right? What we said, step 1 is identify and remove the offenders. Step 2 is good digestive hygiene, which is what we're talking about here. This is good digestion hygiene to get the most out of your food, to give your gut the best chance at digestion. Again, especially if you struggle with poor gut function. All right, so last thing, one of the questions that always comes up is are there things that I should be taking supplementally? Are there nutrients that and I'm not gonna go through the entire library of nutrients that you could use for gut function. If you have specific questions, pump those into the feed. But I'm going to talk about a few ones that I think for people in today's world can be very, very helpful. And one of them is just a really solid probiotic, right? A solid probiotic, especially if you've got a history of antibiotic use, especially if you've just recently come out of a surgery and they gave you an antibiotic post-surgery, or they IV'd you with an antibiotic when you were in the hospital, etc. But a good probiotic to support the friendly microbiome, which is also going to support digestion. L-glutamine is important because it's the fuel for your enterocytes. What is an enterocyte? Enterocyte are the cells of the small intestine. The cells of your small intestine, the ones that can become leaky. Okay, these cells don't use glucose for their energy. They use glutamine for their energy. This is why glutamine can be so important. It's the primary source of fuel for the enterocyte. So if your enterocytes are worn out, if they're broken down, if they're struggling and they're not making adequate energy, glutamine can sometimes be the jump start for the enterocyte to help your gut seal and repair itself. Number 3 on this list is a digestive enzyme. Okay. With gluten protection, if you're not sure whether or not you go gluten-free, I have a formulation called Gluten Shield, which has gluten protection, but also is a spectrum of digestive enzymes. If you really struggle with digesting your food, a digestive enzyme sometimes can make or break that digestion, especially if you've got, as I mentioned earlier, pancreas or liver issues. If you've had your gallbladder removed, these are things that you're definitely going to want to consider as supporting your body's ability to break down and digest. Acid, betaine hydrochloride, a form of acid, especially if you've got a history where you have low stomach acid or low stomach acid production. Where I see this most, so take note of this, if you are a blood type A, so if you have a blood type A, if you know your blood type, if you're blood type A, those folks really struggle with adequate acid production in the stomach. So if you say example, you eat 4 ounces of meat, you're going to struggle breaking that down. This is a genetic issue with type A blood types where they struggle with having adequate acid to break those things down. So this can be super supportive in those cases. But additionally, many people, like I said, that think they have heartburn actually don't. They have low stomach acid because there are a number of different reasons. One of the biggest reasons is chronic gluten exposure. Gluten damages the cells in the stomach. They're called parietal cells. And these cells are responsible for naturally producing acid. But if you've got gluten damaging those cells, a lot of people on initially going gluten-free, trying to recover their guts, their stomach is damaged and so not producing adequate acid to break down or digest the proteins in their diet. And this can be very helpful for those individuals. Another one, as a gut relaxer, so if you struggle with the constipation side of things, magnesium can be ultra effective at relaxing the muscles of the gut and allowing for a more regular bowel movement. Magnesium is also very critical for healing and repair and for energy production. So if you've got inflammation or an inflammatory bowel issue, this could be very, very helpful. Now, vitamin C can also help it pulls water into the bowels, so it helps bring water into the bowel and helps flush the bowels. So vitamin C can help not so much as a gut relaxer, but as helping support or stimulate a good bowel movement. But additionally, there's research that shows specifically in people with celiac that vitamin C helps to reduce the inflammation in the GI tract, and that looks kind of mangled, sorry. Reduces the inflammation in the GI tract. And this is what's interesting about in celiacs, research shows that 92% have persistent inflammation even though they've changed their diet. 92%, research shows, have persistent inflammation even though they've gone gluten-free. And this is what we suspect is that they're malnourished, and one of those nutrient deficits, oftentimes in my experience, when I measure, the people that come to see me, we measure their vitamin C, it's oftentimes low, and this is a very powerful ally, or at least it can be, to help those individuals. So that's kind of, a crash course overview of some supplements that might be beneficial or helpful. But if you've got more specific questions, maybe we can get to those as well. Let's go up. There was a question about cacao. I think it was about chocolate or cacao, the effect of cacao on the gut. The biggest thing that you have to be concerned about there is caffeine. Caffeine can be a gastric irritant. If you already have GI damage, a lot of people don't realize this is why they keep drinking their tea or their coffee. If their gut's already damaged, they oftentimes struggle to repair or recover. And the reason why is the caffeine. And so we get most of that from either, chocolate, coffee, or tea, or diet products. A lot of your diet products contain green coffee extract or guarana seed extract or some form of plant that is very rich in caffeine. And so that caffeine, again, can be a gastric irritant and continue to damage. So that's what you would have to worry about with cacao, potentially. Let's see here. I like this. Filene's asking, when going keto and burning fat, are excess toxins being eliminated? Yes. Excess toxins are being eliminated if you've got a lot of fat in a history of illness. We actually give that a name, Filene. It's called angry fat. Okay? Angry fat is fat. Remember what your fat is. Your fat's a storage facility. So if you've lived a lot of years where you've made some bad decisions with your food, with your diet, been exposed to a number of poisons or toxins through your choices and behaviors, your body, one of the ways your body tries to get rid of those toxins is by storing it away in your fat, especially those toxins that can create oxidation. So when you go keto or when you go on a diet with caloric restriction and exercise and you start burning into your fat stores, you're breaking that fat open, and many of those toxins that were being stored are now being released into your bloodstream, and now your liver, your kidneys, your skin, your GI tract has to deal with those things. And so again, it just depends on how much of that you've got stored in you. But I've seen cases where people have pretty severe response Now, especially in the obese, the very inflamed obese individuals will have pretty bad angry fat reactions overall. Angeline asking if I help people with schizophrenia. Yeah, it is, and it isn't off topic, and I'll tell you why, Angeline. Schizophrenia is a major one that starts in the gut. Somebody asked, I saw in the feed earlier, somebody was asking about water fasting and recovery of schizophrenia. And, that it's not that the water fasting cures the schizophrenia. Remember what water fasting does. Water fasting removes the food, right? And if food is the trigger for the schizoaffective disorder, then you've now removed the trigger. And this is where water fasting, we see the same thing in other autoimmune conditions where fasting, 48-hour fasting, leads to dramatic improvement overall in symptoms. So then it just becomes an issue of reverse engineering what to remove, because you can't drink water forever and not eat food. You'll starve to death. But to answer your question, do I help folks with schizophrenia? Yes. Actually, one of my very first patients was a young man. They actually, they thought he was going to try to kill himself. It was a very tragic case until, his mom brought him into my office. But he was so far gone. He had actually made an attempt a couple of different times at suicide. And for this young man, it was a combination. For him, it was gluten, but it was also dairy. He would actually sleepwalk. Interesting story. This young man would sleepwalk into the kitchen at night, open the refrigerator, and drink buttermilk whole. And his mom would find empty cartons of buttermilk in the refrigerator the next day. But when we figured out he was allergic to dairy and sensitive to gluten, and we made those dietary changes, he regained his clarity of thinking. He was on multiple medications, including things like Abilify and Seroquel, which are very powerful, antipsychotic medications. And we were able to wean him off of those things and make a full recovery just by altering his diet. That's the power of diet change. Don't ever let a doctor tell you nutrition's not important. It's the most important. So a couple of you asking about schizophrenia tonight. Elizabeth asked about it. Macedo asked about it. Angeline asked about it. So hopefully that's helpful for all of you. Sutania wants to know, is organic butter okay to eat on a gluten-free diet? I don't recommend it unless you can verify the source of the dairy. Remember that one thing that hasn't been adequately studied that needs to be studied, maybe one of these days when I retire from clinical practice, we'll do a research study on it, but hopefully somebody else will do it before then. We don't know whether the gluten or the grain product, the gliadin and the other glutens from grains pass into the milk of cows. We know it does in humans. So like in humans, if a mother eats gluten, then the gluten proteins actually show up in her breast milk. So if she's breastfeeding and the baby's gluten sensitive, the baby could have gluten reactions. So in those cases, we recommend we don't recommend not to breastfeed. We recommend for the mother to go on a gluten-free diet. But the cows themselves, if you can't verify, what the cows are being fed appropriately, then the risk really with dairy is that nobody's really adequately studied whether or not gluten can pass through into the dairy of cows. Aside from the fact that many of the cows today, the type of dairy they produce or the type of protein in their dairy is a known trigger for multiple forms of autoimmunity. And I'm referring to A1 casein as the type of dairy in most commercial dairy cows. Let's see here. Can severe stenosis in the cranial arteries be reversed? Depends on what causing it. There are a number of reasons why stenosis can occur, and I would say the first part of your question is to identify the triggering component of the stenosis. Is it a calcium plaque or an arterial plaquing? Is it stenotic because the vessels are in spasm? And I've seen both cases, where somebody maybe was calcium magnesium deficient. They were prone, their blood vessels, their arteries were prone to vasospasm, and so they had stenosis, which just means narrowing. And I've seen cases where plaquing, arterial plaquing due to years of inflammation was contributing to that. So it just depends on what's contributing to it and how bad it actually is. So Joni, my son has colitis. He's seeing an MD. He's pretty picky eater, but trying to get better. Any advice and supplements? Yeah, I have a formula for people that actually have colitis, so I have several different formulas, but one of the ones I have is called GI Soothe, SOOTHE, and what it has is it has some mucilaginous plant-based agents in it that help basically with colitis. The intestinal lining of the large intestine is very, very raw. And so just the act of eating in and of itself can create inflammation because the skin, if you will, think of the internal essence of the GI tract as a skin, so to speak. It's very raw and very inflamed, and so anything can irritate it. This is why fasting can work so well, short-term fasting or controlled fasting in colitis. But GI Soothe is a mucilaginous, so it can help coat and line that area and try to help reduce some of that angriness that's there. So Dahlia, kind of similar question. I have a flare of ulcerative colitis. Once it's started, how do I stop a flare? The first thing you do is you fast. You really got to get a good grip on fasting. 24 to 48 hour fast will help get that under control really, really quickly. Beyond that, you really need to work with a doctor, because it depends on why you had the flare. And that, again, going back to what I have said over and over and over again, identify the trigger, remove the trigger. Something caused the flare. It didn't just happen in a vacuum. You did something that triggered that flare. So what was it? Another question, is there an alternative to NSAIDs for taking for relief of pain post-surgically after bunion surgery? We use something called white willow complex. It's a formulation that I have that can be used as a safer substitute. The other thing you can do is you can combine vitamin C, about 5 grams, with quercetin, and I have a formula called Ultra Q that we use very frequently in people. We combine, again, about 5 grams of C with about 4 grams of Ultra Q, and that can work really, really well to support that. What to do for severe constipation when a female goes to the bathroom only once a month when she has her period. So that's pretty severe. There's not a magic bullet for that. I mean, I do have a product that can help with bowel movements. It's called GI Restore, but it's not something I recommend that you take on a daily basis. It's more for that, that overcoming that severe bout of constipation, but not to take on a daily basis to have a regular bowel movement. You've got to figure out, Angeline, why that's happening. That's again, the real kicker. There's a reason why your bowels are not, the muscles in your bowels are not peristalsing properly to push that food through you. What about food combining? Somebody's asking about food combining, like combining protein and starch or fat and protein. Generally speaking, some people do struggle when they try to combine fruit with meat. And that's most of the time, it's not in regular healthy people, but it's in people with compromised GI tracts. And so that's an area where if you're looking at multiple foods, sometimes one of the best things to do is to eat predominantly one substrate of macronutrients. So like only eat carbohydrate in that sitting, or only eat, meat per se, or protein in that sitting, or only eat fat, or predominantly. It's impossible to only eat one of those things, but predominantly, because most real foods have kind of a mixture of carbs, fats, and proteins. But you can select things that are, higher in carbohydrate, for example, lower in protein, or higher in fat but lower in protein, or higher in protein without any carbohydrate, etc. Let's see here. IV infusions with vitamins and minerals. Some now offer IV vitamin and mineral as well as glutathione, zinc, vitamin C, and these are going straight into the bloodstream, avoiding absorption problems in the GI. Yeah, so number one problem with IV. IV is great if you can tolerate it. Where IV fails, in my opinion, is IV can be a source of corn. A lot of times your IV bags are GMO corn, and they just don't tell you, and you don't know, and you're getting that direct into your bloodstream. Not good. Now, if that's not the case, let's say that you're not getting that The IV, generally what you're doing is especially if we're talking about water soluble vitamins. So these are vitamins like your Bs, so B vitamins and vitamin C. They have a very short half-life. And so an IV, you have to understand an IV is only going to be good for 1 to 2 days. And then everything you had IV'd in you is going to go out your kidney, out through your urine, predominantly sweat, urine. So you get 1 to 2 days. So an IV, if you have a plan where you're working with the doctor and they're saying, okay, look, let's do an IV twice a week for the next month to support your nutrition as we clean up your diet and get your gut working again, this can be valuable. IV can be valuable. But if you're trying to solve your vitamin and mineral deficiencies by IVing and bypassing your broken gut, you're going to be sorely disappointed, and you're going to go broke pretty quick, because IV nutrition can get expensive, especially if you do it right. And you don't want to have to rely on it in order to feel well. You want to be able to rely on food. At the end of the day, your goal should be eat the right diet, eat the right foods, get the right nutrients, because your gut functions and works, doesn't leak, and doesn't create a systemic inflammatory problem. So hopefully that helps give you a little light on the IV components. Again, it can be a powerful tool, but it shouldn't be the only tool that you're anticipating trying to get you to get better. I've seen people, they come to me from all over the world, people do, and their prior doctors were just doing IV. There was no strategy. There was no long-term game plan. It was just, let's IV you and you'll feel better. Well, that doesn't fix why the problem is there. That's what we call, when you give vitamins, or any herbals, or really anything that's natural, when you give natural remedies, okay, natural remedies to treat symptoms, it's what we call green medicine. Green medicine is no good. I mean, it doesn't mean you can't use natural remedies from time to time to treat symptoms that are discomforting, but true medicine, true functional medicine, is find out why. Ask that question. Why are the symptoms there? If you're not asking that question, you're using green medicine to mask that. And so that's what I call, boil it down, it's called pseudo-compassion, false compassion. When a doctor wants to help you, they're trying to be compassionate about how you're feeling. But if they don't ask the right questions, it's not true compassion. True compassion is asking the tough questions. It's asking the hard questions and getting serious answers. And sometimes that means answers you don't want to hear. Many of you don't want to change your diet. Many of you don't want to eat right or exercise or go to bed on time or do the things that is required to restore your health. And many of you do, right? I don't want to, create a damning accusation for those of you watching. You're obviously here because you're trying to learn, but I want you to learn it right. Don't seek the short-term benefit in lieu of ascertaining the long-term change that needs to be made to give you true compassion and true health. Okay. Let's see. Scroll down on the right there. I don't understand your question, Rajendra. Who are good candidates for my Warrior Bread? Anybody who wants to have a grain-free bread option. If you are wanting a grain-free bread that won't wreck you, if you're gluten sensitive, you're a candidate for Warrior Bread. Shinquillo, is it wild rice, black rice, or both that are safe if avoiding gluten? It's wild rice. Black rice, not okay. Wild rice specifically. How do you figure out the best probiotic or prebiotic to take? Go down just a little bit more. The question's being cut off. To take and digest. How do you figure out which one's the best? I'm a little biased in this case. I think my products are the best. We formulate them to be free of contaminants, garbage, GMOs, and other things. And it's the same products that we carry at Gluten Free Society are the same ones that I use in my clinical practice. And so in that regard, if it's good enough for my patients, it's probably good enough for you. And so that's where I tend to lean toward bias. That's how you find the best, is you go to glutenfreesociety.org and check out our supplement store. Gwendolyn, my dad has low blood pressure. He is a dialysis patient with multiple myeloma. He suffers from constipation, but stool softeners give him diarrhea. Should I be avoiding certain foods? I mean, with that kind of a problem, yeah, there's probably a lot of things he should be avoiding. You know, your dad needs testing. He's in too dire of a strait. If he's doing dialysis and he's been diagnosed with that severity of a condition, then he really needs, you know, not just generic advice or guidelines. I mean, he could, you know, if you want to just do anything with him right now, immediately, you could get a copy of my book and go follow phase 2 of the no grain, no pain diet. But that's just strictly, that's guessing at it. You know, with his situation, it sounds like it's a lot more complicated, and you might want to get testing done to get much more specific. Digestive enzymes, do they help with leaky gut? They can be a strategy to help a person overcome leaky gut, but by themselves, in and of themselves, are not going to repair a leaky gut. Let's see here. Is schizophrenia an autoimmune disease? Boy, the schizophrenic questions keep coming in. Yes, there's a lot of evidence that shows that schizophrenia is an autoimmune process. Is going into a carnivore diet the best way to heal IBS? No, not necessarily. Carnivore is very helpful for some people, but in my opinion, it's not a long-term strategy. Carnivore, you know, you can stay on it, and for many people, they feel a lot better initially, but if you stay on it for prolonged periods of time, you can actually create additional imbalance issues in your overall nutrition. So if you're going to be carnivore, if you're considering going carnivore, my advice would be just get with a good functional doctor who can measure your nutritional status periodically, just to make sure you're not derailing your nutritional levels. Can leaky gut cause itching of the skin? Yes, it can. It absolutely can. Is there a connection between the gut and tinnitus? There can be, depending on the type of tinnitus. There are different forms of tinnitus, but some of them are damage to the vestibulocochlear nerve, which is the nerve that feeds your inner ear mechanism. And so when we see, sometimes we'll see people with gut damage where that is the case. And I've seen cases where tinnitus goes away when we deal with their gut issues. And I've seen cases where tinnitus doesn't go away. So it just depends on, again, the root cause of yours specifically. Let's see, go down on the right there. Somebody's asking about our Ultra Hemp. It's good for both. Somebody's asking about leaky gut. Look, here's the real issues is hemp and CBD are not going to cure the gut. Not going to cure it. They're going to activate certain receptors that help to modulate inflammation, but they're not going to cure the why. But a lot of people will use hemp or CBD, you know, as a symptomatic relief, because it goes back to this. What you're doing is green medicine. You got to find the trigger. You got to find the origin. Hemp can be a great thing if you're struggling really bad, but ultimately don't just, you know, find hemp or CBD and then give up trying to find why. You got to go back to the why. Sheila wants to know how to increase your stomach acid if you have low amounts of it. Depends on why it's low. If it's damage to your parietal cells, then you've got to support your stomach. You've got to support your body's ability to heal that damage. If it's that you have, you know, naturally lower stomach acid, for some people it's a matter of being, especially if you're a blood type A, it's a matter of being kind of closer to a pesco-vegetarian diet where you're eating a lot less meat, or because meat is what creates the burden. Meat creates a digestive burden if your stomach acid's not being produced in adequate quantities. For some people, stomach acid issues are because there's an infection in the stomach or there's a problem in the stomach directly. So getting with the doctor to get those things identified can all be helpful. Some people find that, you know, using, I mentioned ultra acid earlier as a supplement. Some people also find apple cider vinegar before a meal as helpful to kind of put a little bit of mild acid on the stomach to help to digest. Okay, go down on both sides here. Let's see, I used to be on B12 sublingual. Is it better to take one that melts under your tongue as opposed to just swallowing the pill? Yes, it is if you have, especially if you have a history of gluten-induced GI damage. The areas that B12 is absorbed, you need healthy stomach cells. You also need, B12 is absorbed in a part of your small intestine that's typically damaged by gluten. And so a lot of people with a history of gluten sensitivity struggle to properly absorb B12 in their GI tract, even though they're on a gluten-free diet. And this is where a sublingual that absorbs through the cheeks and the buccal mucosa can be very effective. We produce one, actually, to my knowledge, I'm the only company in the world that produces a corn-free B12. Most of them have corn in them. That's what they use. The different sweeteners that they use, the different flavoring agents that they use are predominantly corn. So you've got to be real careful. If you're looking for one that doesn't have all that nonsense, check out methylcobalamin. That's methyl, M-E-T-H-Y-L, methylcobalamin. Donald's asking about how serious are probiotic side effects when your immunity is low. Most probiotics come with that warning. You know, I've never seen anybody with low immunity react poorly to a probiotic. Where we'll see people react to a probiotic, generally speaking, is if they have something like a pre-existing bacterial overgrowth in the GI tract, and the probiotic might create a lot of gas or bloating for that individual. Additionally, we'll sometimes see people that don't do well with certain strains of probiotic, but do better with spore-based probiotics. They don't tend to cause some of the GI symptoms. We have different varieties and different options, but you know, one of our premier probiotics is called Ultrabiotic Defense. One of our spore probiotics is called Biotic Force. But I wouldn't, you know, if you've got low immunity, I wouldn't worry so much about taking a probiotic per se. They're safe. They're safe regardless. I haven't seen anybody with, you know, with an immunosuppression disease have a hard time tolerating a good probiotic. Let's see here. Oh, back up just a little bit. Is it safe to use sodium citrate? I mean, generally there's no problem. I would say if you're, you know, sodium citrate in what regard? If you're talking about just sodium as a sodium salt with citrate attached to it as a binder, what's the source of the sodium would be my question. If we're talking about true sodium, are we talking about monosodium glutamate? Are we talking about like a sea salt? Or are you talking about like an added ingredient in a supplement? It's hard to answer that question without specificity. Locust bean gum and gelling gum, are those okay? Gelling gum is generally pretty safe and benign. Locust bean gum can be very challenging to digest, and that's really one of the core problems with gums, is they can be challenging to digest. Remember, they're gums. They don't break down very easy, and if your gut is already compromised, if your GI tract is compromised and struggling already with digestion, then an abundance of gums coming through the diet might not be the best idea, at least not initially. Let's see here. Same thing with acacia gum. Same thing with any gum, guys. If you're talking about gums, really the two taboo gums, the ones that I would tell you to steer clear of is, if you're talking about for ingestion, is one is xanthan gum and the other is carrageenan gum. Carrageenan gum has been shown in a number of studies to cause gastrointestinal inflammation, so that's one I would just recommend that you steer clear of. Scroll down just a little bit here. There we go. Not sure I understand your question, Chucho. If you're eating all of your food in an 8-hour window, you should not have food in your gut when you go to eat again 16 hours later. The normal gut transit time is about 10 to 12 hours. If it's taken you longer than that to pass a movement, you got something else going on that needs to be looked at and addressed. How long after beginning good bacterial supplementation do you most start to see a positive effect or changes to mood? That's a big question, Melanie, because it's not like a specific time frame. It depends on why the mood is disrupted. And there are a lot of reasons why. So, I mean, you could be taking a great probiotic, but if the probiotic is not related to why you're having or struggling with a mood problem, then it's not really you're not gonna see any change. So it depends on what is creating the mood dysphoria or the mood issue. Okay, keep going down there. What words of advice would you give a parent with a 10-year-old child with 2 pancreatitis hospitalizations? It's beyond advice at this point, Esther. It's no longer words of advice for your 10-year-old child. It's now, you do as I say, this is my house and I'm your parent and I brought you into this world. That's the word of advice I would give to you, is you really got to lock down the diet. There is no deviation. With pancreatitis hospitalizations, I mean, you're talking about the potential of life and death. Pancreatitis is a very, very acute, very, very dangerous, very, very life-threatening condition. So if your son is already on board, if the child is already, I say son, I don't know if it's son or a daughter, but if they're already on board with diet change and everything else, then the advice I would give you as a parent is less advice for the child and more advice for the parent. Seek out functional help. You've got to figure out why that's happening. And until you figure out what the trigger is, you're going to run the risk of future hospitalizations and potential danger. That's what I would say, more than I would give advice to the child. I don't know, Wanda. Why do oncologists say no to take vitamin C when you're on chemo? Because they don't know anything about nutrition, and they've been. It's kind of like, why do dermatologists tell you to avoid sun when sunshine doesn't cause skin cancer? Sunburning causes skin cancer. The two things are very, very different, sunburning and sunshine. Why do oncologists say to avoid vitamin C when you're on chemo? Because they have a fear, an illogical fear, I might add, but a fear that the vitamin C is going to interfere with the poisonous action of the chemotherapeutics. I would say in my opinion, you would support the body with vitamin C if you were choosing to go through chemo and not fear the interference. But again, that's between you and your oncologist. I can't speak for them specifically. Keep scrolling down. Keep going. We're running out of time here. I'm going to get 1 or 2 more in. What can I use when I am in a migraine and don't want to? Didn't see the question get finished there. Don't want to use. Didn't see the question there. Okay, that's a good one there. Okay, so Deborah, I was diagnosed with celiac in 2016. I've recently been diagnosed with microscopic colitis. I'm ending my 2nd round of steroids because my symptoms came back after the 1st round. The steroids have been effective when I'm on them. What else would you suggest? Well, the steroids aren't fixing your problem. This is what we call this not green medicine. We just call that medicine, right? Steroids suppress the immune system and stop the inflammation. But what we really want to understand is what's causing the inflammation to occur. With colitis, I can tell you the celiac disease, microscopic colitis, your diet's wrong. And that's why you're having flares, and that's why you're having to go back on the steroids, is your diet is off. You've got to get your diet dialed in. Start with no grain, no pain phase 2. And then, as immediately as you can, work with a functional doctor and get some help. Because navigating that serious condition, without good help is, it's not a good idea. Can foods cause phlegm buildup and coughing? Yes, they can. Actually, one of my only symptoms of gluten exposure for me personally was coughing. I had a chronic cough that went away when I went gluten-free years ago. Okay, guys, it's 23 minutes over the hour, so I tried to get as many answers in for you as I could, but I'm out of time. I got to go home and eat dinner. I've been intermittent fasting myself. So, hey, look, thanks for tuning in and sharing your Monday evening with me. If you're new to the show and you want more, make sure you come visit me, glutenfreesociety.org. Sign up for our newsletter there. You can also tap into our video archives. If you want to learn about specific topics, you can go to the site, you can do a search and tap into our video archive where we've got over 1,000 videos chock full of information to help you navigate this crazy, crazy world that we're living in, and to help you get sanity around your diet, to get sanity around your health, because the way it's done in the mainstream, in my opinion, is insanity, and you want to avoid that. So come back and visit me next Monday night for another episode of Pick Dr. Osborne's Brain. Again, thank you so much. Hope you have a great week. Wishing you excellent health. See you next time. Hey, don't forget to tune in next week, same time, 6 p.m. Central Standard Time for another Pick Dr. Osborne's Brain show. Bring all your toughest health questions to me. I look forward to answering them. And before you leave today, make sure you hit subscribe. And once you do, click that bell. That bell is going to allow us to remind you right before we go live, but it's also going to allow us to remind you when we come out with other video content all week long. We've got lots of episodes coming your way all week long, and I don't want you to miss anything. So again, subscribe, hit that bell so that you can get notified when we have that new information put up for you. Thanks so much, and I'm wishing you excellent health. Have a great week. We'll see you next Monday night.